The current healthcare measurement system does not include the voices of patients or communities. Measures are developed without understanding the lived experiences or needs of those hardest hit by health disparities, systemic racism, marginalization, or overall poorer healthcare services. So what can we do to address these inequities in measurement? We can begin by changing the measures to better capture the factors that impact the health of communities. Community organizations understand the assets, needs, and experiences of communities. They take a holistic approach instead of focusing on one characteristic or experience. They can provide key insight into the measures most important to patients and communities.
Let's look at maternity care, for example. We're not accounting for everything around pregnancy that's affecting adverse outcomes or poor outcomes. Is it transportation? Is it not having enough food? Is it the effect of intimate partner violence? All of these things are not accounted for in maternity care measurement development because health systems don't know how to deal with them. We end up with what we really know. What can we do about C-sections? Okay, we'll measure those. But can you do something about referrals to community-based organizations? Can you do something about a support system? And that's the problem. We only measure things that we know. Measures are only created for problems that we feel like we have solutions for, not for what we really need to be worrying about. We need to account for everything that affects poor outcomes. And that means looking beyond what happens at the doctor's office.
When we talk about healthcare from an Indigenous point of view, we have to talk about the impacts of historical trauma and environmental hazards, because this has also been passed down through generations. When we go to the hospital, we're usually asked, are you safe in your home? But providers should be asking questions like, do you live in a uranium contaminated community? Do you know of any type of extractive industry in your community? Because these two questions hugely impact our health. Within our county, a community called Church Rock is labeled ground zero for the largest radioactive spill in US history. As a result, it has led to many health conditions. Decades after the spill, we now have a cancer center in our community. Our natural way of living has hugely been disrupted because of these types of industries. We experience lack of jobs. We have difficulties accessing clean water and healthy foods in our community. And we need to make sure that everything that we're experiencing is captured in healthcare measurement.
Equitable partnerships between community organizations and measure developers are critical to capturing data that communities, healthcare systems, and policymakers can use to improve lives.
We work hard to elevate the voice of the community partners. For example, Chicago has a community health survey that we do every year. One year, they had about 18 Asian responses. We said, we have a connection with the community, with other nonprofits like ourselves, and we really want to do this right. We took the citywide survey and modified it so that it was culturally and linguistically appropriate for different communities. We're bordering 3,000 survey responses right now. We have disaggregated data from 9 different communities, 9 different cultures. We have multiple languages. That's health equity right there, because we provide the voice of our community partners and we're receiving population-based data from the actual population.
Community-driven measurement means taking a step back and being there for what they need. You should directly ask people experiencing poor outcomes, what will help you? What would you need? Instead, we just come up with solutions and expect community partners to work with us. Let's train community organizations so that they have the tools to do this work, lead this work, and partner with us in this work. Then they can choose or develop measures that are valuable to them. You'll be surprised to see what comes out of it.
Equitable partnerships between measures developers and community organizations can help advance health equity. To accomplish this, we must shift power back towards communities. This means community organizations must be included as equitable partners with shared decision-making power within the healthcare measurement ecosystem. And that measures developers should engage in equitable partnership with community organizations to develop trust and to create an equitable healthcare measurement system. Measures that are community-driven will move us closer to using measurement as a tool for systemic change and also advance a more equitable healthcare system that can help eliminate health disparities.